we want to consider is what we call the initial coverage period of Medicare Part D. This is when the deductible has been met, either because the plan has waived it or you have paid it, and you've entered in what's called the copay and coinsurance. And the copay or coinsurance you're going to pay depends upon the tier. All Medicare plans use a tier system. Usually it's tiers 1 through 5. Occasionally you see a tier 6 added onto the program. Tier 1 is typically generic drugs. Tier 2 is considered non-standard generic drugs. Tier 3 is what they call preferred brands. Tier 4 is non-preferred, and Tier 5 is specialty medications. Now, it is possible that you could be taking a brand name drug that a plan decides to cover on Tier 2 with their generic medicines. It's also possible for you to take a generic medication that a plan decides to cover on Tiers 3, 4, or 5. And that's why reviewing the drug coverage is essential. Now, we recommend that everybody create an account at Medicare.gov, a My Medicare account. When you get prescriptions at the pharmacy, they'll automatically update there. You can also add medications, and that gives you an idea of how your plan is going to cover those, and you can compare it to other options during the open enrollment period. We also can help guide you if you're having any questions about that to figure out what will work for you, because the copay and coinsurance can vary depending on the carrier, depending on the medication you take, depending on the tier they decide to place it on. So once you know you need to take original Medicare and you've decided what path you want to go, either A, B, C, Medicare Advantage with drug coverage, or A, B, original Medicare paired with a Medigap and a standalone drug plan, you're in a situation where you need to have some form of Medicare Part D outpatient prescription drugs. Now, it's important to always have creditable drug coverage once you have Medicare, because if there's gaps in creditable drug coverage and you need it later, you can be penalized for not having Medicare Part D. You typically are going to pay a monthly premium for Part D, and those are premiums that are offered through the various private insurance companies, because you can't get Medicare Part D directly from Medicare. You always buy it as a standalone policy, either a standalone paired with a Medicare supplement, or you buy it embedded in a Medicare Advantage plan. But all drug plans, whether you're getting it embedded in Part C as part of your program, or you're getting it as a standalone policy that you pair with original Medicare and a supplemental, all follow Medicare's standard design for drug coverage. Now, every calendar year, Medicare adjusts their standard design, and all the plans that offer Medicare Part D must enhance their design to at least the standard level, or they can enhance beyond that if they're trying to make their plan more competitive. So it's important to understand the basic design and how it plays into the various plans that you're looking at. Now, when you make your decision about the Part D component of your coverage, if you're choosing Medicare Advantage, you're going to want to look at the doctors that are associated with that plan, but you're also going to want to review the names, the quantities, the prescriptions that you take to make sure that they're on the plan's formulary or drug list at a competitive tier and without a lot of special rules, or if there are, you're going to want to know about those up front so you can work with your doctors to get approvals. When you do original Medicare with a supplemental, you're buying a separate policy for standalone drug coverage. That can be from the same or a different company. And here, you're going to be looking at, once again, the drugs you take, the dosage, the quantity, the frequency, and evaluating all the available standalone drug plans to see which one will best suit your needs. All of them are following the standard design, but they have different lists of medications, and what works for you may not work for the next person based on your needs. Now, the standard design for Medicare includes a deductible. A deductible means you have to pay that amount of money before your Part D coverage kicks in. And Medicare adjusts that deductible every calendar year. For 2026, the standard deductible is $615. Now, on many Medicare Advantage plans, they eliminate that deductible altogether. The Part C programs, that's one of the enhancements they often offer to that type of program. Or they waive it from generic drugs and reduce it for brand name drugs. Or sometimes they have a full deductible for all tiers. It depends on the program. But frequently on the Medicare Advantage side, you'll see companies trying to enhance that benefit to make their plan a little more enticing and enhance it somewhat so that you'll be interested in purchasing that coverage. On standalone drug plans, Typically, if you're on a low-cost plan, you're either paying the full deductible on all tiers, or you're paying it at least for prescriptions that are on what we call tiers 3, 4, or 5, which are typically the brand names. So on Part D standalone, even if you're paying a significant premium, if you're taking brand name medications, it's very likely that you'll be paying at least part, if not all, of your Part D deductible for your prescriptions. That's part of the overall cost associated with that Part D plan. Now, what works for you is going to be dependent upon your needs. You can change drug plans every January if you need to. Your enrollment period is October 15th to December 7th, and that's your opportunity to add and change prescription drug plans just like you do on Medicare Advantage Part C. So that's an opportunity to reevaluate if the plan is not meeting your specific needs. The deductible is an important piece. No plan can charge you more than a $615 deductible, but they can charge you up to that. They can apply it to separate tiers, certain medications. They can do a lot of things to adjust that deductible, and that's part of what you want to look at when you're comparing plans. Now, the next thing we want to consider is what we call the initial coverage period of Medicare Part D. This is when the deductible has been met, either because the plan has waived it or you have paid it, and you've entered in what's called the copay and coinsurance. And the copay or coinsurance you're going to pay depends upon the tier. All Medicare plans use a tier system. Usually it's tiers 1 through 5. Occasionally you see a tier 6 added onto the program. Tier 1 is typically generic drugs. Tier 2 is considered non-standard generic drugs. Tier 3 is what they call preferred brands. Tier 4 is non-preferred, and Tier 5 is specialty medications. Now, it is possible that you could be taking a brand name drug that a plan decides to cover on Tier 2 with their generic medicines. It's also possible for you to take a generic medication that a plan decides to cover on Tiers 3, 4, or 5. And that's why reviewing the drug coverage is essential. Now, we recommend that everybody create an account at Medicare.gov, a My Medicare account. When you get prescriptions at the pharmacy, they'll automatically update there. You can also add medications, and that gives you an idea of how your plan is going to cover those, and you can compare it to other options during the open enrollment period. We also can help guide you if you're having any questions about that to figure out what will work for you, because the copay and coinsurance can vary depending on the carrier, depending on the medication you take, depending on the tier they decide to place it on. Not every plan covers every single medication. By law, all these drug plans, whether it's a standalone drug plan or a Medicare Advantage Part C, Medicare says you got to cover at least 2 medications in every therapeutic class. But that doesn't necessarily mean the particular medication you want or the one that your doctor is looking to prescribe for you is covered in every plan's included list. All things being equal, when we evaluate drug plans, we'd like to put you on one that has your medications on a competitive tier on their covered list. Sometimes people take things that aren't on anybody's standard covered list, or you suddenly need something new that isn't covered by your particular plan. So while every plan has a formulary or drug list, exceptions can be made. That process is called prior authorization. That means your doctor will contact the plan and say, look, my patient needs this medication. They've tried other medications that haven't worked. They've gone through step therapy. They can't take the other combination of medications for whatever reason. And then the plan is going to evaluate that and make a decision on whether or not that medication is going to be covered, and if yes, what tier it's going to be covered on. It's important that you get your Part D medications either covered initially or approved if a formulary exception needs to be made, because any cost you pay towards covered medications or approved medications is going to go towards your Part D max out of pocket for the year. For 2026, that maximum is $2,100. The problem is if you take a medication that's not covered by the plan, or you're buying it from another resource and not getting it through Part D, any expense you pay does not go towards that $2,100 max out-of-pocket ceiling. So it's important to get your medications covered and hopefully to get them covered through the plan. Now, in the past, people, when they went on to Part D, they could be responsible for an unlimited cost really on their medication costs. There was no ceiling on what people would pay. That $2,100 for 2026, they're adjusted a little bit each year, is your max out of pocket for covered medicines. That means is if your cost reaches $2,100, you're going to pay zero for the remainder of the calendar year. So this is a lot of peace of mind, whether you're on a standalone drug plan or a Medicare Advantage plan. You know, if you have catastrophic needs, if you reach that ceiling, you're going to have no additional out-of-pocket cost. Now, the calendar year ends 12/31. Starting every January, this starts fresh, and released in October-November timeframe, Medicare releases the design for the next calendar year, and that can adjust the benefits somewhat in terms of what is available. Also in October each year, your drug plan or your Medicare Advantage plan is going to send you an annual change notification. So that's where you're going to learn changes to the benefits, changes to the deductible, and that could be part of your decision in terms of what you'll do for the next calendar year. The important thing is that you want to make sure that you have Medicare Part D, either embedded in an Advantage plan or as a standalone policy. You always want to show that you have creditable drug coverage every step of the way on your plan. And the most important thing in evaluating the coverage is making sure that your medications are covered at a competitive tier at the lowest possible cost. We can help you with Part D. It's an incredibly complicated part of the whole Medicare program. Just suffice to say that it's important to have a Part D drug plan in order to evaluate for you what's going to work. The names, the dosage, the quantity, and the frequency of the medications you take are really important to compare that to the available plans in your area. If you're interested in Medicare Advantage Part C, in addition to the prescriptions, we also want to have your doctors so we can evaluate the whole picture in helping you make the determination that will work for you. If you're doing original Medicare with a supplement and a drug plan, what we want to do is make sure that we're looking at all the prescriptions you take and matching you up to the right program that will meet your needs. For this and any questions that you have, you can reach us at reservations@blackpointinsurance.com by email or give us a call, 415-328-0385. As always, we're looking forward to working with you.